we talk about diabetes type 1, type 2 diabetes. Now, Bob wants to explain to you how you can control your diet to prevent from type 1, from type 2 to type 1. So you were diagnosed as type 2 diabetes, right?
Correct, yeah.
And you control your diet, you change the drink you used to have, and you never use insulin, right?
No.
Okay. And insulin is a chemical that, or hormones that it can cause inflammation. So your doctor may tell you that, oh, eat whatever you want, and then you just change your medication, add insulin. Actually, insulin is a growth factor. It can cause cancer. It can cause inflammation in your blood vessel, in the nerves, and that's why patients with type 1 or type 2 diabetes, they develop neuropathy, but you never develop neuropathy, right?
Right. I think when I was on type 2, I still am on type 2 diabetes, but I have friends and I know of situations where people that are on type 1, and I have a close friend that has been on insulin for over 50 years, and his circulation in his legs are poor. He's had toes amputated, and I know of people that have had their ankles and they can no longer walk. They're in wheelchairs. So when I see the results of not controlling type 2 and letting it advance to type 1, it's very easy for me to stay on the proper diet and keep my levels as low as I possibly can.
And so you never complain of numbness, tingling, or pain on your feet, right?
No.
So that means the circulation on your feet and hand are still pretty good. So controlling diet is very important, and also you are very active, right? During the day, you're doing gardening. You just move around. You never just sit there watching TV, right?
Right, and I think the activity and the diet, is essential to good levels.
Yeah, so in order to stabilize your blood sugar so that you don't develop a type 1 diabetes, which means your pancreas is failing, you have to add insulin. So controlling diet is the most important thing, and also add physical activity. That way you can keep your circulation, your nerve, your blood vessel in a normal range of function.